Hi, I'm Dana Sletter. I'm the Nursing Education Coordinator for Labor and Delivery here at St. Joseph Mercy Hospital in Ann Arbor. Today, I'm going to show you how you use a Ligasure. First, we would get the machine up from the operating room. This is the Ligasure machine. First thing I would do is plug the machine in to the wall. Remember, all of our OR equipment needs to be grounded. This has a 3-prong plug. I would plug it in to a 3-prong outlet and turn the machine on. The on-off button is right here in the front on the lower left-hand corner. Okay. As the machine is warming up, we would go to the 2 typically used devices that we have here in the OR. For our cases, we usually use these either for tubules when we're doing a self-conjectomy, which is our smaller piece of equipment right here, the curved small jaw, open sealer and divider. And as you can see, it is a small handheld instrument. The other one that sometimes we use is called the Ligasure Impact. It is for tying off bigger vessels. A lot of physicians like to use this for our hysterectomies. Here is what this would look like. And then on the back, you can see it's a much larger handle. It appears that my machine is now ready. So once we know which device our physician would use, we would open the package sterilely. So there's always a little loose tab here. I would pull the tab towards me, leaving this package open for the tech to grab this instrument sterilely and place it onto her field. Once she has done that, this is the part she will have kept sterile. You will then need to come in with this piece. Notice the cord is purple. When you look at the machine, there are 2 spots for Ligasure. Ligasure 1 and Ligasure 2. Notice Ligasure 1 is purple. That is exactly where we are going to plug this small Ligasure into. So I will plug it in, and notice when I do, you get green lights across the Ligasure 1. Typically, our physicians are going to want it on full strength. These green bars here, those are our strength. So if I press just the single bar, that's strength number 1. That's the least amount. 2 is middle, and 3. That is how you would raise it all the way to the 3rd bar, and that's how the physicians usually use this machine, by either bar 1, 2 bars, or 3 bars. And pretty much that is all you would have to do. Now, after opening the package, I would encourage you to save this item, which is the paper that was covering the packaging. If you notice, right here you have a reference number. If we are able to bill for these, this is the reference number you would place in your pick list in SurgeNet. The other item you need to be very careful with is down here. On any piece of equipment we use in the OR, there is always a use by or an expiration date. And I would caution you, since we do not use these very often, if there is these handles stored in our supply rooms, please verify the expiration date before you put it onto the operating field. Once the case is done, you would remove it from here, turn the machine off, and then this is disposable. It's a one-time single use. It just gets pitched into the trash. If you have any further questions, please see myself or Laura Bozeman regarding the Ligasure. Thank you.